Good evening, everybody. Again, this is another Around the Kitchen Table. And today we're going to talk a little bit about the latest news that's been making headlines, and that's RSV. RSV is a viral infection that seems to be affecting a lot of our youth, a lot of our kids, a lot of the young ones. And RSV can cause copious amounts of secretions, lots of congestion, at least in the first 3 to 5 days, with complications getting worse, or usually they'll get better by 7 or 8 days. On average, most kids probably last between 8 to 14 days of congestion, cough, and whatnot. Usually those kids that get better in the first 5 to 7 are going to get better without any treatment. Those are not the problems. After that, there's a lot of complications where you get lower respiratory inflammation, bronchial inflammation, spasms, things like that. And in kids who have underlying respiratory problems, RSV can be very dangerous. But right now, you're seeing multiple hospitalizations as people are facing RSV for the first time, especially the kids under 2 or the kids who have underlying asthma, allergies, or heart disease, problems of that nature, premature kids. All those ones are having a little more problem with it. But most kids who get RSV, again, get better with the normal hydration things, plenty of fluids, nasal saline, steam, humidity, keeping them hydrated. All of those things work really well. And majority of kids with that will get better. But those kids who have ongoing wheezing, shortness of breath, many of those kids will need supportive care, and some of that means hospitalization. Oftentimes we might need in those kids to use anti-inflammatory medications, i.e. steroids, or sometimes we'll have to use albuterol or other bronchodilators. Many of them are not used routinely, though, okay? Most of the time it's just going to be humidity and things like that. So if you need to use those others, oftentimes they'll do x-rays if the child is having poor saturation, oxygen saturations, shortness of breath, wheezing, retractions, things like that. Most kids, again, with RSV will recover without any problems at all. And I think that's the majority of kids. And so you should know that RSV, just like the flu, just like COVID, is extremely contagious. The respiratory virus itself can be spread, very easily from child to child. And once you get RSV, you can shed that virus for up to 8 to 10 weeks. So even though you may feel a lot better, you're still probably shedding that virus. But I wanted to do this video because I want parents to not be so worried about this, that yes, their child may get this, but the majority of kids will get better without any treatment. As far as treatments are concerned, if you think that child is not getting better, is not eating well, not wetting diapers, is wheezing, shortness of breath, those are kids that need to be seen. You need to be seen by the doctor either in your office or at the hospital. Again, if you have any other videos, things you want to talk about, we're here at Around the Kitchen Table. And I think these things, as they come and go, we're gonna try to highlight what's ever current in the news. If you have questions, comments, leave them, and we'll talk. We'll discuss it more. Thank you for being around the kitchen table.